Hello Bastrop. Today is Friday, April 3rd, and I'm Connie Schroeder, your mayor. I'm wearing my blue shirt today for National Go Blue. April is Child Abuse Prevention Month, and let's all keep that in mind. A lot of things have happened since I talked with you last Friday. The governor's issued a new order. There's been all kinds of press and news about it. Let's talk about what it really means. It really means stay home. That's, at the end of the day, the way that we protect our community is to stay home. We're in a medical crisis, and I know, you know, I'm not a doctor, and I can't give you medical advice. I was so pleased that Dr. Desmar Wachs, who serves as the Bastrop County Public Health Authority, agreed to an interview. She's going to give you some timely information and fill in some of those medical facts. Dr. Wachs?
My name is Dr. Desmar Wachs, and I am the Bastrop County Local Health Authority. I've been in practice in Bastrop since 1994. This is home. When we have issues like what's going on right now with COVID-19, I work in conjunction with the Department of State Health Services and the Region 7 Medical Director, Dr. Sharon Melville. Right now, we're swamped. We have a virus that's amongst us that is something we've never seen before. This is different than the flu. We have no treatment for it. We have no vaccine for it. So the message that you've been hearing consistently from local officials and state officials and federal officials is stay home. And that really is the message that I want you to hear as you listen to me during this time. We have a new, what we call a novel virus in our midst. And unlike other things that can become a threat to our lives that we can see, like fire and flood that we've lived through here in Bastrop County so many times, we have now amongst us a threat that we can't see. And it doesn't always show symptoms. So when you see someone who's asymptomatic, they may actually be carrying that virus. And then you may see people who are sick who have the virus or don't have the virus. So because there's so many unknowns, the message is stay home. Now, why do we say that? We've had a lot of experts from all across the world, and particularly in this country, who've done research to show that we can do what's called flattening the curve. What does that mean? Well, when they're speaking of a curve, they're speaking of a graph of what happens when people get sick, and on one line, and what happens to the medical infrastructure, the medical providers, the doctors, the nurses, the respiratory therapists, the people that clean the hospital, what happens to the supplies that we have to use to protect ourselves, and you've heard a lot about that, personal protective equipment. We are looking at what that rise in that curve does to the limitations of that system. And we are not in a position to withstand the impact of that curve rising rapidly. So we need to flatten the curve to save lives. This virus causes flu-like symptoms. In some people it's mild. They get a fever, cough, maybe some body aches, and they feel like they've got the common cold and they're fine, and they stay home. That's what the message is, stay home. And they're treated with things that help their symptoms, like Tylenol or throat lozenges or eating, resting. Then there are some people who have more risk of much more severe disease and require hospitalization and actually end up needing a ventilator. Now, I didn't mention ventilators when I was talking about the medical infrastructure, but in this instance, when people need a ventilator, they are really, really sick, and we do not have a good supply of ventilators. So we need to flatten the curve by keeping people at home, staying home so they don't get sick, so that particularly those people who are at risk don't get so sick that they need a ventilator, and we have to make that decision on who gets one and who doesn't. I don't want to have to do that. I want you to stay well. I want you to listen to me, Bastrop. Stay home. Thank you.
Thank you, Dr. Wachs. And I'm so glad each of you got a chance to hear exactly how she feels about it. You can tell it's extremely important. It's important to her and it's important to our community. She talked about asymptomatic. That's a medical term. Let me talk to you about it in general terms. It means people can have it and not know they have it. They may not be running a fever. They may feel just fine. This virus attacks everyone. It doesn't matter your age, it doesn't matter your gender. We can't see it. That's what makes it so hard, and that's why the plea is for everyone to stay home. If you can't stay home and you have to go shopping, just send one person from your family. And when you're shopping, just take what your family needs. Always be kind to others. You can make the difference. Please stay home, Bastrop.